First of all, welcome to Pacific Dermatology. My name is Dr. Doug Keel, and my philosophy for the practice is that I wanted to provide the highest level of medical care in a very warm and comfortable environment. And so I think that we've recreated that in Pacific Dermatology here. My goal again is to treat every patient as a family member, as I would a family member. And I think that keeps me treating them at a very high level, and it keeps me honest. And what would I do with a family member, and to make and do the right thing for them. Over years, I trained and I practiced in very sterile environments, and it was they were just cold and non-inviting environments. And I think that everybody has been a patient in an area that of a practice where they just haven't felt comfortable. And so over the years, I felt like, okay, there's a better way to do this. We can make the patients more comfortable when they walk in the door. It doesn't have to feel like a boxed-in, closed environment. It's open. It's a very luxurious waiting room. It's elegant, with very few people waiting in the waiting room, because we want to get them back into the exam rooms and actually treat them. It's got a very feng shui feeling. It's open and inviting, and that's the way we like to keep it. I'd say it's one of the cleaner offices that you'd see. We have a nice coffee bar and refreshments. We have extra amenities like a relaxation room where if you're going to numb up for a procedure, or we have to put on some creams and you're going to be here in the office for a while, you can actually sit and relax on a couch and enjoy a magazine and a little bit of coffee or a soda, and wait for your procedure. We have chapstick. It's free chapstick, and so if you come in, you can take as much as you want. Not handfuls, but one chapstick, and that's one of the amenities. I think it's really important to protect your lips. Everybody in Southern California is in the sun and exposed, and why not? It's SPF 15 and it's great. The exam rooms are large. You're not boxed in. You don't feel claustrophobic. It's very open and inviting. Our staff makes sure that we do everything they can to create comfort and warmth. And that starts from the beginning when you call the office all the way through to the checkout process. I'm originally from San Diego. I grew up here. I went to Torrey Pines High School, and growing up, I either wanted to be a doctor or a pilot, and so kind of crazy different things. But it turned out that I was actually both. I was a naval flight surgeon, so it was a great experience to do both. And then I got into dermatology and did my dermatology residency here in San Diego. During the time, it was very interesting because all of the lasers, the technology was just starting to be invented. The lasers for hair removal, the lasers for vascular and blood vessel treatments, lasers for skin resurfacing and tightening. All of those were brand new at the time, and we were part of the first groups that were experimenting with these lasers and actually getting them to do things that they'd never done before. And so my practice really grew from that experience. I fell in love with dermatology and really, I saw the benefits of what these lasers could do and what we could do for the skin and really improve people's appearance. We really focus on three areas in this practice. So the three areas that we focus on are: one, injectables and fillers; two is lasers, obviously, and three is medical dermatology. So that's kind of how I break things down. For injectables and fillers, it's interesting. There's been a significant shift in the thinking over the last few years from kind of a two-dimensional model to a three-dimensional model. And now we're looking at aging faces in more in three dimensions. So the injectables we do, we volumize first. We fill down deeper in the skin, and that gives us scaffolding for the skin. And then we use line fillers to go on top of those to kind of smooth out fine lines. And then we can combine that with Botox or another muscle relaxing agent to really turn back the clock and really create a more youthful appearance, but keep it very natural. The laser side, again, we have the best technology, and I think, as our name implies, the Cosmetic Laser Center, it's a very important part of our practice. We evaluate new lasers, and we evaluate new equipment every year. And it keeps us really on the cutting edge of technology and the best we can do for skincare. Sometimes people need more than one laser and one procedure for the job, and we have multiple lasers, and we have the equipment all in the office so that we can walk them from room to room or laser to laser to get the job done. And then third is medical dermatology, and that's anywhere from acne to skin cancer. There's a lot of potential complications that can come out of either of these conditions, scarring, disfigurement, and I think that there's a lot of patient concern for that, and obviously it's our concern as well. If we can get into the process a little bit earlier, it's possible that we can maybe offer a non-invasive treatment or a preventative treatment so that we can really change the course, and so these conditions don't have to be so intimidating. We don't rush our appointments. Patients have as much time as they need to talk their way through, and we can explain the procedures to them. There are other things that we can do. We can show before and after photos. We can have them talk to other patients about their experience, and I think that those things really help patients kind of get a feel for what this is going to be like. A lot of our office staff has done these procedures before, and so it's very comforting knowing that they can talk to somebody that's actually been through the procedure that they're going to do or they're considering, and that really helps to guide their way. One of the best parts about my job is that I get to see the excitement and how excited people are to see themselves after some of the cosmetic treatments that we do, and also even after some of the medical treatments we do. I have patients that suffered from acne for years, and it's amazing some of the treatments, their skin is clear by the end of the treatment, and how it just changes their demeanor, how they can feel more positive about themselves, and that is, that's really gratifying for me. I watch patients actually grow up. They're kids when they come in, and they're adults when they leave. They go off to college, and it's really pretty impressive, to see the change in their demeanor. I look forward to actually stepping in the door every day. It's just a very warm, home away from home feeling, and our staff is fantastic. Everybody in the office here, and we call each other team and friends, but we are all good friends, and we have a good time at work. We enjoy each other's company, and we get things done, but it's in a friendly environment. I really love everything that I do. Every day that I show up here, I'm excited to be here. I take my time and I do what I need to do, and I do it right every day. And at the end of the day, when I leave, I'm satisfied that it's been a really great day, and I can't wait for the next one.